we have Mr. Ahmad Shahizam, President and Managing Director of KPJ Healthcare Bahar, one of the leading hospital groups in Malaysia. He was also previously the CEO of Pantai Holdings Bahar, and he was also previously the Director of Investment in charge of healthcare for Malaysia Sovereign Wealth Fund Khazanah. So to start, perhaps each of you may have 5, 6, 7 minutes to share with our audience your insight and experience on these topics. And then we can go to a group discussion thereafter. So let's now go to Mr. Ahmad from Malaysia, and I would like to hear about your observation from your perspective.
Thank you, Bernard. It's my pleasure to be here today with all of my esteemed colleagues, and thank you to the organizers for inviting us. On behalf of KPJ Healthcare Berhad, we are actually the largest private healthcare group in Malaysia. We run the largest system of private hospitals in Malaysia with 28 currently, and another 2 to be open over the next 2 years. We also have a very integrated platform. So not only we run typically tertiary level hospitals, we also have a very large network of ambulatory care as well as ancillary services in the country, covering services such as diagnostic imaging, pathology labs, rehab centers, as well as medical education. So we even have a medical university within our system. We are about 15,000 strong, and we have a system of about 3,400 beds across Malaysia. But we are also currently present in places like Indonesia, Bangladesh, as well as in Australia. For us, the pandemic itself has been a real wake-up call, as I think it has been for all of us in healthcare, not just in the region, but globally. What I think has been very fundamental in terms of how the way that the pandemic started, as well as how it progressed, was really, it laid bare to a lot of assumptions I think a lot of us had in terms of the general preparedness of any healthcare system. And I think in Malaysia, that itself was not an exception. By and large, historically, I think in Malaysia, we've always had a very good public and private healthcare system. But I think the pandemic itself really challenged some of the assumptions underlying how well this system is able to cope with unexpected sort of crisis, and especially of the nature that we had when we started to see the impact of the pandemic full-blown starting last year. I think in most instances, there's a lot of lessons that we have learned, not just in terms of how we have had to deal with the pandemic, but also in terms of what else that needs to be done and how we can better evolve ourselves to ensure that we remain relevant to the needs of the healthcare requirements of our population. And I think this is really some of the key learnings that we've also had. At KPJ, we moved very quickly, even before the government sort of initiative to start to restrict movement and do widespread testing and so on. We believe, or we saw the need to really increase in terms of our abilities to manage. So very quickly on, I think as early as January, we started to look at testing regimes to quickly be able to identify how to look at how to manage what is essentially a public health challenge that was becoming by day an increasing sort of crisis. This was facilitated by the fact that within our organization, we had all the various components, starting from at the early stage, having LabLink, which I think Abra from Quadria was our partners until recently. We started to ramp up in terms of our presence as well as ability to do testing, in particular for COVID-19, but also to see how we can actually start to expand our ability to do extensive testing and supporting the government's initiatives in fighting this. And I think that's another sort of the element that we saw in Malaysia, at least. There had to be a mindset shift, in particular in terms of the ability for the health system to work holistically as a whole. So a good example and a perfect example of this was actually in Malaysia, where the government, instead of trying to fight the pandemic on its own, really sort of marshaled all the resources in the healthcare space, including from private healthcare. So from very early on in Malaysia, there was a very high level sort of approach where there was a sort of prioritizing or focusing different parts of the system to manage different parts of the problem. So, for instance, the government facilities were identified to be dedicated locations to manage active COVID cases, whereas a lot of the private sector was helping to support the ongoing care of patients who were not impacted by COVID. As we know, life goes on beyond the pandemic, and I think there were a lot of other sort of patients who also needed care that were able to be managed. So in this regard, that was one area that there was a lot of increased cooperation between the public and private sector. And I think this is one of the key lessons. Beyond the preparedness and ability to translate from public health issues to actually managing issues on the ground through enhancing protocols and so on, is also how we coordinate to better manage system resources. So when we had to, as a system, increase surge capacity, this ability to demarcate between public and private resources and to utilize both effectively was very important. Not only in testing, so private labs were also very actively involved in testing for COVID alongside government labs, also in terms of managing cases. And eventually, especially at the start of this year, when we move into the subsequent phase of vaccination, the private sector played a very significant role of also adding and helping to the capacity. And at KPJ, we have been playing our part, and we are, I think, the largest group, or we had the largest number of vaccinations being done by a private healthcare group, which is continuing until today. In fact, I just had my own self, my third booster jab. And now in Malaysia, we are very glad to see that this sort of efforts have paid off. We're coming to a very high level of national vaccination, over 90+%. And this is a continuing effort that also required participation from both the public and private side. I think the final part that I would sort of highlight is actually the importance of actually looking at how we do things on the ground from a different perspective. A simple example, it was almost inconceivable that we had a situation where we were not able to access, or for our patients to access our system as easily. Things like movement restrictions, or concerns about going to hospitals were real issues that had to be dealt with. And here I think, instead of just being a buzzword, the ability to serve our patients in multiple ways, in particular using technology, digitalization, for instance, has been very, very instrumental. Not only this allowed us to do things like telemedicine consultations, where patients did not have to come in physically, but also leveraging on things like home delivery of medication, online sort of renewal of prescriptions, even to the extent of having test results for COVID-19 being made available, electronically, and reducing contact points to ensure that we will able to provide our core services without too much disruption. And I think this has really been the golden opportunity, because it actually pushed a lot of our patient and consumer behavior to be more willing to adopt the digital opportunities that we've always had, but not really getting the same uptake that we would have liked to see in the past. So I think these are some of the key learnings and lessons that we saw at KPJ.
Well, thank you, Ahmad. I think you're absolutely correct. And early on, I mean, maybe not so today, even for Hong Kong, but early on, say last year, and people try to avoid from going to the hospital. It's like the most dangerous place in the city, so no one dared to go to the hospital. I think the whole idea of delivery of medicines and COVID test result, I think you're absolutely correct. This is, I think there's no turning back now. Once it make it so easy for patients, I think people would want that to continue even after the pandemic. One of the largest bank in Thailand, a bank, now morphed itself into a tech company. Well, first of all, for sure, the share price has gone up because the valuation for a tech company is far more sexier than a traditional bank. So the question now, I'm going to ask all the other speakers here, do you agree with what Brad just said? I mean, how prepared are we going to, we're still an healthcare provider, but then how far and how much should we adopt technology in your entire business model? Who should go next? Should I ask Ahmad? You want to go first?
Perhaps, yeah. Thanks, Bernard. I think that's a very, very apt question. And I've always been a very strong proponent, not just recently on the back of the pandemic, but even many, many years back. Having been looking at other different industries, when I first started looking at healthcare, maybe about 10, 12 years ago, what was very obvious was actually, despite the technological advances and opportunities that has been driven by overall digital adoption across the board in economies, healthcare sector has typically been very slow in adopting and adapting. And I think this is really, I think, what the crux of what Abra was saying. And when you position that against the very significant and fundamental challenges that literally affects lives, one just wonders why this has not happened before. And I think in many ways, I would agree. Our adoption of technology has not been the way that we've seen elsewhere that has taken place. But I think this, as I used the word again earlier, a wake-up call, because there is no ability, there's no way for us to move forward if we do not actually start to rethink and start doing things differently from how we've been doing things traditionally. And I think this is really some of the biggest issues that we have to deal with. And it's actually just not just in any one group. It's actually all the stakeholders in healthcare that needs to start to change how they look at behaviors. We talk about patients and consumers. And we can see that in the past, there was a huge reluctance, at least in Malaysia, for people to use virtual consultations. But because of the need, and I think with the use of platforms like Zoom that we're on today, for instance, people are now getting a lot more familiar and more comfortable to start doing that. But we cannot expect that to happen overnight, nor can it continue if we do not to push and really sort of get further in this regard. So to me, it's an opportunity, but that window will close again if we do not sort of seize the changes that has been forced upon us. Other sectors, for instance, other stakeholders. Let's not forget the clinicians. Generally, in medicine, the clinicians are very established in terms of their thinking and how they approach the ways to address issues. Quite often, this comes at the expense of innovating or trying something new that may not have been done before, but can be done in a much better way. And I think the lessons that we've seen and the need to move quickly and in an agile manner has started to force a lot of clinicians from where they used to be in terms of how they adopted technology to a level that now perhaps will open the doors for greater, embracing of technology that can be done. I mean, simple example, during the pandemic, for most of us, our radiologists had the opportunity and advantage of being able to report from the safe confines of their studies rather than going to the hospitals, because the widespread availability of PACS systems, and all our hospitals are digitalized on that basis, that was possible. But that was just one area. But again, it's just a very small sliver of the opportunities that we need to be able to expand and make it as a commonplace. The final area, I think, is regulatory frameworks. The governments and regulators have always been very, very mindful in terms of how they regulate the healthcare sector. It's one of the tightly regulated sectors in most jurisdictions. But the experiences required of how to move quickly and to be able to adapt to the changing situation has forced a lot of governments around the world to really relook at how their own decision making has been. I mean, a good example is if you relied on your traditional approach for vaccine sort of approvals, we would not be able to quickly ramp up and bring in vaccines for COVID-19 the way that we've seen. The way that we were approving new modalities, new equipment, and so on. All this, I think, are pointing towards the direction that there is a a lot of changes in our own behaviors collectively that we need to do, but the opportunities and technologies and the enablers are already there. So I think for me, the biggest lesson is really that it's time for the sector, the industry, to catch up with the rest of what everyone else has been doing already. And that, I think, can only be for the betterment of everyone.
Yeah. Well, thank you. So much takeaway from each of you. I learned so much this afternoon. I think the pandemic will continue, and I'm sure each of you and that all the entire sector will need to continue to adopt, be very agile, and try to create opportunities along with this crisis. So I want to, on behalf of the Hong Kong Trade Development Council, thank each of you in taking part of this topic, very important, and I'm sure that our audience are very happy to have this occasion to learn from the different perspectives from your respective countries. So thank you very much. I will ask the organizer to give us more time in the future to invite you all back again. Thank you.
Thank you.
Let's have a
Thank you very much.
Let's have a photo.
Thank you very much.